Hello, and welcome to today's presentation brought to you by the Life Sciences team here at ReadTech. This meeting is being recorded and all audience members are muted. We do encourage questions, so please submit them at any time using the chat box. We will cover as many as possible during the Q&A at the end. If you're having problems hearing the audio through your computer, try calling the phone number listed in the email invite or on the screen by clicking on the phone icon. After this live presentation, the slides and video link will be available to all registrants. Let us start with a poll question so we can learn a little bit more about this audience as you all continue to file in. So bear with me here as I get it pulled up. All right, so here's our question. What are you not sure of regarding Basic UDI-DI? What is the difference between UDI-DI and Basic UDI-DI? How should I group devices within one Basic UDI-DI? Where is the Basic UDI-DI used and or applied? How do I report Basic UDI-DI to UNIMED? Or how do I use Basic UDI-DI in non-EU markets? I'll just give you a few minutes to answer those questions and then we can share the results. All right, I'm going to go ahead and close the poll and share the results. It looks like most of you are looking for answers on how to group devices within one Basic UDI-DI, but we've got a few pretty solid on the middle two questions as well. This is great. Hopefully we'll get to everything you have questions about today. I'm going to go ahead and hide the poll and move on to our presentation. So thank you so much for your participation. This is the second installment of our Ask the Expert series. We'll be covering Basic UDI-DI. Our speakers will give you a general overview and several scenarios that might occur with Basic UDI-DI, followed by a Q&A session. Special thanks to those of you who submitted questions in advance. We'll cover as many questions as we can during this session. Any questions we don't get to will be responded to directly by our team of experts after the recording. We are so pleased to introduce our panelists for today's talk. We've got Gary Sainer. He's a subject matter expert on medical device, unique device identification, and other structured content reporting to regulatory agencies and commercial organizations. He has over 30 years of experience in software development, process management, and data administration, with the last 15 years focused on the life sciences industry. He serves as co-chair of the industry's structured product labeling technical team and on the advisory board of the Medical Devices Group. Next, we have Ronald Boumans, formerly a senior inspector at the Dutch Competent Authority for Medical Devices, the IGJ, and a senior regulatory consultant at Emergo. He now owns his own consulting company, Boumans Regulatory Consulting, and serves as founder of the PRRC Academy. I am Sam Page. I'm marketing manager for the medical devices here at ReadTech. Please feel free to reach out to me directly with any questions following the presentation. And at this point, I'm going to hand the mic over to Gary and Ronald. Take it away, Gary.
All right, well, thank you very much, Sam. Would love to continue on this series. It looks like we have a really good topic today. Ronald and I have been putting some slides together, some material. So our discussion will cover a couple different areas. First, we get a lot of questions from those in the audience and the clients that we talk to about what in the world is this Basic UDI-DI, grouping activities and so on. We'll give an overview of that. There are some activities, some next steps that you should be aware of, things that you need to do now and things that you need to do in the future to get that on your calendar. And then to help it really sink in, we've put together some scenarios. And these scenarios pretty common. You might be able to relate to them. If not, maybe it's close to your particular portfolio. But these scenarios help you understand the actual implementation of Basic UDI and some of the grouping activities, what you can group, what you cannot group. And then we have some Q&A at the end. As Sam mentioned, there's a number of questions that came in early, and we're going to try to pull all that information from Ronald as we can and get a lot of time, and we'll do some rapid fire questions and answers at the end using as much of the allotted time available. And With that, let's get rolling on an overview. And I have to confess, um, when Basic UDI rolled out in the European Union regulations, I was really confused. There's no precedent in International Medical Device Regulatory Forum. There's no precedent with the US FDA implementation, South Korea, or China. So there was really no forewarning that something like this would come down the pike. But there it was in the medical device regulation and the in vitro diagnostic regulation. And to be honest with you, I read those definitions well over 20 times, and there's things that are in the UDI definition that are repeated in the basic UDI-DI, and then there's some things that are that I think are misleading about the unit of use. But let's get rolling here. Ronald hopefully can sort all this out for us. And I will mention that basic UDI-DI, you'll see that a lot in literature, but many times there's nicknames or abbreviations for that. You might see Buddy DI or just Buddy. And I'll use probably all three of those variations up on the screen at some point during today. But Ronald, let's go through the regulations. What in the world do we have here, and how is Buddy different than the UDI? And I think we're going to have to look at some of the MDCG documents to help sort this out. But let's get rolling with the regulations first of all. Can you help us out here? This is the definition for basic UDI-DI.
Yes, thank you, Gary. Yes, the basic UDI-DI concept, I typically refer to it as the basic UDI, period. And then you have the UDI-DI, which is for the device at the device level. But the basic UDI is a code by which you identify device at a higher level. So a full device family can be identified by a basic UDI-DI. And then you have the different models within that family that are identified by their own UDI-DI, and they're linked together. So you have one basic UDI linked to multiple UDI-DIs. As they say, it's assigned at a level of the device unit of use. Now, that is that's just to confuse you. Most of the times, the unit of use is just one. Right, one device, and that's it. But sometimes you have to use 2 or 100 or whatever to make the device work. So at that level, the basic UDI is defined. So if you're using, let's say, 12 devices at the same time, so they need to be used together, like a set of screws in one implant, and you need to use all. Then you can refer to that group with the same basic UDI-DI. But don't worry about this, the unit of use thing. It's a detail. At the moment you hit that, just go for a good expert. They help you through that, talk you through. It's nothing you should worry about. So the basic UDI can be used to identify records or files in your UDI. So it can be used to identify records in a database. So if you have devices, you can identify all the particular devices in an unambiguous way by using the basic UDI. And you can also use them at the level of technical documentation. So you can identify which document belongs to what device. So that helps a lot. Now, if you look at the UDI-DI, then you have it's a number. So it's a code identifying the device, and it's linked to the basic UDI. And this can be used to access data in the UDI database. It's interesting what happens if you look at it on an international level. So you have a UDI on the device, it's a code on the label, and you can use that same code globally. But that's basically the idea. But in every market, so like Europe, the US, China, they have their own way of managing data. And so each code in each market refers to a different data set. So in Europe, you have UDI-DI with all the data concerning that. And you can use UDI and the basic UDI to identify everything there in UDI-DI. And that's how devices will be assessed from the by the authorities. So it's a tool. The basic UDI and the UDI are used to navigate through all the different devices that are there to make sure everybody involved can identify unambiguously a device. As Sam said, I've worked as an inspector. I've had huge issues of identifying what exactly is the device we're looking at now. So I'm very happy to see UDI now rolling out. Next.
All right, very good. So I think, well, that certainly helps a lot. Thank you, Ronald. There is some additional information that is put out by the Medical Device Coordination Group, the MDCG. There's lots of guidance there. There's a couple particular ones that have to do with basic UDI. Do you want to highlight some additional insights that we find in those guidance documents?
Yeah, you can find some more detailed explanation about what is a basic UDI. So the basic UDI groups devices with the same intended purpose, the same risk class, the same essential design and manufacturing characteristics. That's what you can find there. And I'll address what that means further in this presentation. So the basic UDI identifies group of devices, and then you have all the other devices are linked under that. That's basically what's happening, and the MDCG guidance sets that out, how that works and how they are linked. They have also all these different UDI attributes. So what is organized at what level? So what is used to identify the basic UDI? What's used to identify the UDI-DI? We'll come to that later.
Yeah,
Next.
so it looks like from what you're saying there, I could have one buddy group that can have one-to-many children.
Yes.
But a device, it can only be in one family, so it cannot be assigned to two different buddies.
Yes.
So that starts to come into play. I know there's a lot of question about defining groups, and we'll get into that a little bit further. I wanted to also share an example. Sometimes it helps solidify the definition and the intent here if we understand a particular example. So in my fictitious company that makes forceps, let's say I create a buddy. We'll talk about the actual construct of what goes into that particular code. But with a buddy, that would be my top level grouping. And I have to have at least one device under that. So let's say I have my pair of forceps that I put in there. It has a unique device identification DI that we're all very familiar with. In this case, I'm using G10 just because it's very commonly used. And it's not uncommon for that basic product to have a package hierarchy. So there might be a pouch that has 3 forceps in it, and I might even have another third level. I put 2 pouches in a box. Each of those have their dedicated device identifier. But when we go back to the grouping, let's say in my portfolio, I also make a variation that has an extra long capability or extra long design, and it meets all the criteria. So I put it in the very same group. Now I have 2 devices in that group, and it keeps on going. So I might have another version that has some locking features, and there might be some other variations. So you start to see the example of establishing a group and defining the devices that go into that group. All right, so let's move on about the actual creation of the code. Ronald, do you want to cover some of the things that we found in both the Medical Device Coordination Group, and sometimes you have to go out to the issuing entity to find the details here?
Yes, basically the Basic UDI is created by the manufacturer. That's not created by someone else. It's created, the code is created by the manufacturer. You have to use a tool that is provided by your UDI issuing agency. The basic UDI has 25 characters, and there is a check character just to check that. So part of your code will identify you as the manufacturer, and the rest is something that you can use for free. And if you remember the example that Gary just used, there he had his some words in the code to identify the exact device. So so he had this my forceps in the code. So and you can use that. So you can use that to help you understand what you're looking at. So each UDI issuing agency, and in Europe there are 4, GS1, HIBCC, ICC-BBA, and IFA. Of course, GS1 is the biggest one, and it has a lot of positive things. In most cases, GS1 is the obvious choice, but please consider the others as well, because they may just have that other edge and other facilities that you have. For example, ICC-BBA is very good at donor materials. You have one donor, like a blood donor, and that material is used in different devices, even devices made by different manufacturers. The traceability of that, they have some very good tools for that. So yes, GS1 is usually the obvious choice, but not always. So carefully consider that. Apart from that, you have some data elements that you need to report in UDIMED to describe your basic UDI, and yeah, as I already said, all devices with the same intended purpose, the same risk class, the same design and manufacturing characteristics, they are in the same basic UDI, and that's something to keep in mind. And you have to be very careful, especially when it comes to intended purpose and the design and manufacturing characteristics. There are some yeah, there's some room to play around, but you have to understand very well what you're doing, because if you get this wrong, you have a problem.
All right, very good. So let's take a look at a little bit of the details in using GS1. You'll find in the documentation regarding Basic UDI-DI that GS1 uses a term that is inside their environment, and they refer to it as a global model number. So it is one and the same with Basic UDI-DI. Yeah, technically, maybe it's a little different, but you do want to go to a global model number in search GM and in the general spec. And there is also an online generator to create the 2 check characters. So let's work our way through this particular construct and how you would actually create a buddy. So we know, as Ronald mentioned, there's 25 maximum characters. You make use of your GS1 company prefix, so there's no additional charge with GS1. You're already subscribing to and receive a GS1 company prefix. You're able to use that very same value. So this is the number. It might be longer or shorter based on how many item reference numbers you subscribe to. But then this is unique. Inside the identifier, this model reference is able to use upper and lower alpha. Surprise, surprise to those GS1 people, where they've been working with numbers in creating G10s. But alphanumeric entries are possible, and then there's 2 check digits, and there's never a barcode created. So this is information that is held in documentation or electronically, but never expressed as a barcode and not to be put on the actual product itself. Now, if we compare this to the G10 that most of you are certainly familiar with, A UDI-DI has that indicator digit in the front, so notice Buddy does not have that. And then the company prefix is repeated, and then there's this item reference field, and again, it might be longer or shorter based on the number of item reference that you reserved, and then a single text digit. And you would always express UDI with a barcode and the human readable on the product itself. So that shows you a little bit of difference. The good news is no additional charge. The bad news, yeah, you have to come up with some identifiers. What are those identifiers at the grouping level? Ron will talk a little bit about the data elements that are connected to the buddy. So we're not going to go through each item here, but there is a record that would be submitted into UDI-DI specifically at the basic UDI level. And that is the key field to identify all these characteristics. You can take a look at those when you download the information, but all of these need to be common for every individual device inside the group, inside the basic UDI group. So if you had 10 devices, you would actually submit 11 records to UDI-DI. One, this particular item record that would be at the group level for the basic UDI. And then you'd have 10 versions of this particular record for each of those devices. And you see a lot more information describing the actual device itself. But noteworthy is in the upper left-hand corner, there's a linking value that says this particular device is associated to the basic UDI-DI with this value. So that is the means by which the 10 individual device records are linked to the one basic UDI record. Now, the UDI-DI is also very key field for this particular record as well. Now that will change for each of the 10 devices. The basic UDI-DI value will be the same for all the 10 records. All right, so we'll leave the rest of that for homework. Let's move on. Ronald, there's a lot of questions about where is this basic UDI used? What's the purpose? How does it help me do business? Is there any return on investment, that sort of thing? But let's start first of all, like where is it actually used and where does it show up?
Well, Basic UDI is used in documentation for your certification and your registration. So you need to identify a device every time you create a document that's related to that basic UDI. So if you want to create a clinical evaluation report, your biocompatibility evaluation, and general safety performance requirements checklist, identify it with your basic UDI. Your notified body will use the basic UDI on the certification, and it must also be mentioned on the declaration of conformity. What I strongly recommend is to have a one-on-one relation between the basic UDI and your technical documentation. So one set of technical documentation for every basic UDI-DI. This is not a full legal requirement, but makes life much easier because, as said, there will be differences between the different basic UDIs. So you will have devices with maybe a different intended purpose, maybe different manufacturing or design characteristics. So that may be a problem. But I recommend if you end up with a lot of technical documentation, you can of course use copies. You can copy a lot. So if you have devices that are more or less the same, you can copy a lot, or you can refer to the same documents. One of my clients is a manufacturer of class 1 and class 2A devices, so it's a fairly low risk devices. I think they have 5 different biocompatibility evaluation reports, and they cover I think something like 60 different basic UDIs with that, and they all refer to the same documentation, to the same document. Well, groups of those refer to the same documentation. So yeah, you can do that. It's the notified body says, oh yeah, that's fine. It's because that report covers the aspects for that particular device. Of course, in UDI-DI, you use them to identify a device. So you can go to UDI-DI, search on Basic UDI, or you can identify a device there. Now, the Basic UDI does not replace your UDI-DI. So your device must still have a UDI, still have that code on the label, and you may even have a hierarchy of UDIs between the Basic UDI and the UDI on the label. So the UDI it's not going to be used anywhere on the label or the packaging. So and also changes in packaging do not impact the Basic UDI. But of course, you have your UDI. That is, of course, impacted by how you package your device. So different package configurations will lead to different UDIs on the label. So that's basically where you use it. So I think it's very important to understand that there's not a strict legal requirement to have a one-on-one relation between the Basic UDI and the technical documentation, but I strongly recommend doing it. If you do it, be very careful, because you may end up with much more work to keep your technical documentation updated if things start changing in the future. So on the short term, yeah, that looks like a quick gain. On the long term, you may have worked yourself into a difficult situation.
Yep. Now, I think there's some additional places that you might want to touch on. We have some content here about where the Basic UDI is used early on, and actually in the conformity assessment and in documentation. Even if you do self-certification, you have to include it. Do you want to talk to some of these different areas that Basic UDI is included?
Yeah, when your device needs to be certified, whether it's self-certified or notified body certified, you need to assign your Basic UDI early on. So then you have grouped your device. That's what I strongly recommend. If you haven't started doing it, start doing it tomorrow or today even, depending on your time zone. But you must start doing that. Start grouping your device, because then you know the structure for your technical documentation and everything from there. So how you can present your device to a notified body and show the evidence of compliance. And also, if you go to a notified body, they want to know what they will be looking at. So they need to know for each risk class and subclass of devices the Basic UDI. So they must know what they are looking at. So they can set up their sampling strategy. And yeah, of course, you have your certificate. On the certificate, you need to have your Basic UDI, not the UDI, because that's on the label, but the Basic UDI, that must be on the certificate. And then in your documentation, yes, of course, your declaration of conformity, technical documentation, and of course the summary of safety clinical performance. It must be there. It must identify those documents unambiguously, link them to a particular data set in UDI-DI. Also related to, that's going to be the future, the data set with incident reports and other cases and other things. And then of course, when you start registering your device, then you need to enter the data for your Basic UDI and link your UDI individual devices to that. So yeah, you need to start somewhere, and that's just your Basic UDI. And of course, if you want to use a certificate of free sale, there you go again. It's the Basic UDI that you need, because these other markets will assume you have organized your data and your compliance documents according to the European requirements, which means you need to link them to your Basic UDI. So it is a very important thing to do, to have in order and to manage.
I did have one question about the EU member regions, say,
Yeah.
I don't know, it's Asia market, Africa market, Australia, whatever, and I guess technically even Switzerland, if they're not in a particular European Union, do they make use of the buddy, or they just want to see it there because it's required in the EU? I don't think they would necessarily have an equivalent, but they might want to use the European Union buddy. Is that your thoughts?
Well, it depends. If you talk about Switzerland, Switzerland is going to copy more or less UDI-DI, and they will rely on a lot of data from the EU. So they will just use the basic UDI like it's used in the EU. So that they will just copy those records, and that will be very convenient for manufacturers because they don't need to enter that. You can just copy your upload your documents from UDI-DI and download your documents from UDI-DI, upload it to Swissmedic. Swiss-DMED, that's what they're going to do. At least that's what they want to do. They had hoped to be ready by now, but I heard there's some delays. But we'll see. And then, of course, you have other markets that accept CE marking, but then you need to have your certificate of free sale. Like the Middle Eastern markets, a lot of markets that use that where you can get access with a CE mark device. But you need to have this certificate of free sale where it says that yes, this is a CE mark device. It is on the market in the EU. It's sold here, so it can also be sold there. That's basically where a certificate of free sale is about. So if you have access to the EU market, you can use that, including your basic UDI, to make sure to communicate to the authorities there what your device is about. Again, it's about an unambiguous identification of a device.
Yeah. So this is definitely an improvement in previous versions of the certificates of free sale. Sam, I think we're going to jump to one of your poll questions next. Are you able to launch that for us?
Yes, sir. Here we go.
Great.
Our next poll question is, what is your progress in implementing EU Basic UDI-DI? Have you not started and need better understanding? Not started but know what to do? Is it an active work in progress? Have you done a portion of your products, or have you done all your products? I'll give you a few moments to fill that in, and then we'll look at the results.
We'll see how far people are on their pathway for basic UDI implementation.
All right, I'm going to close the poll, share it, and
Oh dear.
so it looks like a lot of people need a little help in knowing what to do, because that not started but I know what to do is at 5%. Most people do need a better understanding, and then we have 28% who've done all their products. Bravo, you.
Good.
Wow.
You.
Yeah.
Yeah. All right. Well, I'm going to give you back the screen.
All right. Very good. So some good progress and some homework to do. All right. Let's move on. Now, everything that we had heard and kind of know now about basic UDI-DI, there are some things that you want to make sure timing-wise that you adhere to. Let's talk about some next steps. First of all, let's talk about some things that you should be doing now. So this is the alarm clock. Wake up and today start embarking on some things here. You want to go over some of the preparation steps and then also some recommended implementation steps here, Ronald.
Yeah, of course, you need to understand the how to group your devices. So there's this NCG guidance. There are other guidances out. Also, if you look on search on the internet, there's some training, and of course, you can also reach out to me if you need help with that. If you do that, carefully consider the granularity because of your technical documentation. And especially when you talk about differences in design and manufacturing characteristics, there is some room to play around. It's limited, but you can do you can play around. So you can have either more devices in a group which means that your technical documentation is less flexible, or you can have a very high granularity, which means you have a lot of technical documentation sets to look after. If you organize that well, and there are systems now becoming available where you can automate that, that may help a lot in doing that. But it is something you need to carefully consider. When it comes to something like the intended purpose, be very careful in deciding that if you have an intended purpose which is not word by word the same as say, well, but still it means the same thing. Then it should be word by word the same intended purpose. If it's not that, make sure you use a different basic UDI. And then you must, of course, review your product portfolio to draft your groupings, and that's when you see the consequences of your choices. If you have grouped your devices, it's always a good idea to have someone, to have an expert looking at it, because this is the moment you can still switch your groupings. At the moment you have developed your technical documentation, you're discussing with the notified body and they're already reviewing. If you need to change then, that's really costly, and it will cost you a lot of time, and sometimes you may not have that time. So yeah, if you create your basic UDI, make sure that everybody in the team fully understands why you're grouping in this way and what it means, and then you can start with creating your devices, map your documentation structure so that it all works, and then you need to organize your attributes so that you understand all these device attributes, and then then you can start working on your technical documentation. So that's the order. And I think if you haven't done that, you're pretty late in the process, because all the other steps, like creating your technical documentation, starts from here.
Mm-hmm. Now, looking forward, there's some timelines. There's actually some deadlines that need to be on the calendar, and you definitely don't want to miss these for various reasons. But do you want to highlight some of the things that need to be on the calendar with a big red circle around them?
Yes. 26 May 2024 has a big red circle. If you have legacy devices, so devices which are not MDR certified, and you watched the news on 20 March of this year, then you probably found out that there is some sort of regulation delaying certification. Well, let me give you the elevator pitch that you have to share with your CEO or board of directors or whatever where you're working. This only means, it's not a full truth, but if you want to summarize it in one sentence, this regulation only means that the notified bodies have an extension of their duty to certify. Manufacturers need to be MDR compliant on 26 May 2024. That's the simple elevator pitch that you have to share. If you miss that deadline, you will lose legacy device status. Right? I repeat, meet this deadline, or you will lose legacy status of your devices. Because the definition for legacy device will change after 26 May 2024. You need to have launched an application for certification lodged with a notified body, and you need to have it signed by September. So you must be you must have something assigned with your notified body already. If you miss that, you lose your legacy status. It's just that you know. And what the notified body will look at is your basic UDI structure. That, well, among other things, but that's where that's where they'll start. So that's how they'll address your devices. So it's very important that you make sure this happens. And then, okay, then if you're linked to a notified body, okay, then they will take the time to do the certification. You're in the safe. But that's very important. 26 May 2024, that's less than a year. That's almost 11 months, just over 11 months. Time is ticking, and it's ticking very fast. Make sure you have everything organized. Okay, enough about that. If you have set up your basic UDI structure, at the moment you become certified under the MDR, you must use UDI in all your records. So then you can start registering it in UDAMED. Until then, if you're not an MDR device or IVDR device, there's no need to register in UDAMED. So once you're certified, you can start entering. For now, there's a voluntary option to do that, so you can do it on a voluntary basis. It is expected that UDAMED will be ready, and that means in the future, which probably triggers a mandatory period of registration of new data after the fourth quarter of 2024, and after the second quarter of 2026, everything must be in UDAMED and be kept up to date. So that's very important. Now, if you have your basic UDI structure within your technical documentation, so you have your data set managing your devices, and things change. You have new devices entered, maybe a completely new concept, then you must keep updating that. So until you are certified under the MDR or IVDR, I suggest you already use this basic UDI concept to organize everything and to identify internally. At the moment you're certified, you can go. You have to go outside and identify externally. This internally-externally communication does not go for the UDI-DI on the label. You can already use that. At the moment you switch from MDR to IVDR, you just make the link with that particular UDI, and you can keep using that on the label. So there's no need to change the label. Be aware that in Europe, hospitals are now starting to request UDI on the label of every device, even class 1 devices, which are for now, which can wait with the UDI on the label for some years to come. So UDI is coming, it's there, it's staying. You can, I suggest you already start moving, because if you don't, your competitor will.
All right, a lot of good advice there, Ronald. And I'm looking at the time. I think what we would like to do now is switch gears a little bit and start to bring up some of the scenarios. They're quote real life scenarios, but they're fictitious, but they should represent actual scenarios. Let's move over to some of these scenarios, and I think it will help the audience understand some of these principles and see how that they sink in. So we're going to move to the first one. And let's say in this particular scenario, there are surgical instruments, in this case, some scissors. Will identify the fact that this manufacturer makes two variations. The first one is all stainless steel. The other one is stainless steel, but it has a coating on it. So it's titanium nitride, and it keeps it extra sharp, whatever. But now maybe there's a difference here. Ronald, can you talk about the impact of looking at these two products, and how do you figure out what the basic UDI might be? Is there one, two? Let's talk about this a little bit.
Well, there is a difference in the design and production characteristics. So stainless steel is a coating. That's a difference. I would suggest that is enough to justify two different basic UDIs. And maybe adding this coating means that you can use the scissors for something else. So there might even be a difference in intended purpose. So they will have different basic UDIs. They each will have their own UDI, which is linked to that basic UDI. The UDI will probably be on the device itself by direct marking. And of course, then if they are in packages, different package configurations, they will also have their own basic their own UDI-DI on the label.
So is this approach that you're suggesting, two different buddies, is that a really good practice, or is there a little bit of fuzziness, and some in the audience may say, oh, well, I'm going to force this into one buddy? You know, they're going to have to
Maybe.
explain intended
Yeah,
purpose
maybe
and,
yeah,
manufacturing technique. You know?
if I mean, if the coating is mainly used to look it better, make it look better, because it's this titanium nitrate coating makes it look nice
yeah.
black. It really looks good. Sorry. But yeah, if it's only for the look, right? If it's only difference in color, okay, then fine. But at the moment, it starts having an impact on the performance of the device, and it really means different production characteristics. But for example, if you have, let's say, different color coatings, and the
Yep.
only difference is the color, right? No basic UDI difference. But in this case, yeah, you have to justify why this would not be a different design or production characteristic, or a different make a difference in the intended purpose. If you can justify that, okay, yeah, sure, then you have one basic UDI. But if
Okay.
I look at how these coatings are used, it's a different thing.
Yep. All right, let's move on to the next one. This one is on a operation table. So let's say a manufacturer places this table out in the market. It has its original label. It has a UDI-DI. It's linked to a buddy in the UDIMED. What happens when this particular table is refurbished by another manufacturer, or perhaps the original manufacturer goes back and does some refurbishing?
Yeah, well, if you fully refurbish, and that's used in the definition of a manufacturer, then it means that you are manufacturing the device. So fully refurbishing, making it a brand new, putting it on the market, placing it on the market as a brand new product, then you have fully refurbished it. You are considered a new manufacturer of a new device. So it's a new basic UDI and a new UDI on the label. So you must remove the label as well. If you just do some refurbishing, so it's bring device back to the state it had when it was originally sold. Then it's more or less maintenance. No new basic UDI is required, but maybe there's a difference between new and refurbished that would justify a UDI-DI, different UDI-DI on the label, that you have to replace the label. I certainly would do that, because also the label will refer to some kind of either the production date or a batch or whatever, which is no longer applicable. So you need to replace that label. And I would highly recommend use a different UDI, just to identify, makes difference between a new and this refurbished device.
All right, super. We're going to move on to scenario 3. Now we're looking at a procedure pack. So I have a collection of suture instruments here. I have the sutures, the needles, scissors, forceps, scalpel, a whole bunch of things. And now I have them available, placed on the market as a procedure pack. What's the impact of this particular scenario?
Now, of course, they are all medical devices. And they should all each have their own basic UDI and their own UDI-DI and their own labeling. Mm-hmm. You put them together, then you're putting a procedure pack together. And as a system and procedure pack producer, SPPP, you can do that, right? You must check, that's Article 22, you must check the mutual compatibility, if you can use them together, and if they're still used within their intended purpose. If that's the case, Article 22 applies. And you have to draw up statements to do that. So then you, as a SPPP, system and procedure pack producer, you can create a basic UDI in UDI and a UDI for that package. So you must add a specific procedure pack label on the outer packaging, while the original devices keep their own labeling. You can only do that if you have a specific single registration number within UDI. So if you're a normal manufacturer or importer or whatever, you cannot do this in UDI. You cannot add the procedure pack UDI in UDI. You have to have a single registration number identifying you as a system and procedure pack producer. Now, at the moment you're a manufacturer and you put two different devices together in a box, you may be creating a system or procedure pack. And you have to, so that's something to be aware of. So if these devices are intended to be used together, specifically intended, they will always be sold together. Okay, that's not a procedure pack. Then it's just two devices that have to be sold together. But at the moment, there are different devices, and you say, well, we can sell them separately, but we can also put them in one box. Then Article 22 applies and you become a system and procedure pack producer. You must have that single registration number. You must take these measures in, you must register the UDI, basic UDI in UDI.
All right, yeah, that's
mind you,
you can easily cross the line there.
Yeah, one more thing. If one of these devices is MDR certified, at that moment, you have to apply MDR requirements for this procedure pack, Article 22, and UDI. Right, so that's something to be aware of.
Yep, really good advice. The last scenario that we want to touch on would be for like an IV pump, and now there's some embedded software in that pump. And let's talk about how you might approach that particular product if that's what you place on the market.
Yeah, you have multiple options. So you may consider it one device. So it's a pump with software. It's sold as one device. You have your basic UDI describing this device, covering this combination of hardware and software, and one UDI, which will be on the label of the device. Now, suppose you update the software, right? Maybe some small patches that you do, then you need to update the UDI PI, or you change this functionality, changes the UDI-DI, or you go even further, you change the intended purpose of the pump. Then you need to have a completely different basic UDI. How are you going to do that if you remotely change the software, right? So that's something that you need to think of. If you're distributing, making devices with software in there, and you remotely approach that software and change things, then the UDI may not be valid anymore. So how to do that? How can you handle that? Well, you could place them on the market as a system. And contrary to a procedure pack is intended for one procedure for one patient. A system can be used on multiple patients. So it's basically a system is reusable or has parts in it that are reusable. So if you have a system, then the UDI for the system UDI, can be kept on record. So kept in a digital file. So it's not on a label because because of the system structure. What you can do, you have two different components. One is the hardware, which does not change. It can keep its label. So that has its label and the UDI. And the software has its own digital labeling, which you can do because you can use e-labeling for software. And so they're separate. And you can update the software and keep managing the basic UDI for the system as well. So the whole data set for the system, you can update that as well. So this works much better. There's a third alternative. You can define the pump and the software as devices that are intended to be used together. So this pump must use this software, and this software can only be used on that pump. That's not an Article 22 system. You can also update that. I think the authorities would prefer Article 22 because then it's easier for them to see that these products are used together. But legally, you can use both. And if you dive into the details of the requirements, there are some differences to go either way. But that's too detailed for this presentation.
Right. Well, these were very good scenarios, and I'm glad we had an opportunity to dive into those and help understand how basic UDI comes into play. We have some time left, and we do have some questions that came in. And Ronald, these are going to be like rapid fire questions coming your way. We don't have written out answers or anything, so we're just kind of go as fast as we can on these. And let's take a look at the first one. I'll read it off to you. In UDI-Med, we must use the EMDN nomenclature codes. Can we assume that all devices with the same EMDN codes are also in the same basic UDI-DI device family?
Well, EMDN is mainly driven by intended purpose. So that means that only part of the definition of a basic UDI is covered. So if you have a different EMDN code, then for sure it's a different basic UDI. But if you have devices with the same EMDN code, you still have to look at the design and manufacturing characteristics to see if they could be different.
Right. Okay, good. Let's move to the second one. If you go for a high level of granularity in defining the basic UDI-DI, you will end up with many declarations of conformity and many sets of technical documents. If we want to limit this, how wide can we define a basic UDI device family? I think you touched on this, but maybe it's good to rehash these particular limits for the boundaries of a basic UDI-DI.
Yeah, well, as long as the intended purpose is between of devices is identical, and word by word identical, that means you have already one condition to have them in one basic UDI family, and then you have your design and manufacturing characteristics. Now, at the moment, those become clinically relevant. Then it's a no-go. Then you need to separate for sure. At the moment, there are serious implications in quality management system because of the different manufacturing techniques. It'll also gets very difficult to keep them in the same basic UDI, but you have some room to play around. As said, I think you can also look at what it means for the future if you have very large device groups in one technical file. It may be difficult to manage that in the future over time, but yeah, you have to be very smart, very careful in doing this, and carefully consider this how you group.
Yeah, don't make this a frivolous decision. Think about how much it'll affect the future. Let's see, the third one coming in here. We have individual devices included in treatment sets. Some of those devices are included in multiple sets. And then as devices are used from a set out in the field, replacement devices are provided to replenish the set. What's the impact for basic UDI-DI in this particular scenario?
Okay, yeah, basically we see this with procedure trays that are used in orthopedics. That's a big problem there. So they are procedure packs. So each device must have its own UDI, its own basic UDI, and and each procedure pack must have its own basic UDI and UDI, as discussed before. That's Article 22. If you replace one of those parts because it's used, if that is replaced by an identical part, the same UDI, then it doesn't change the set. So yeah, you can keep that. but there are some issues there because I mean, if it's like a hip replacement, okay, that's big enough. You can have the UDI on a UDI carrier on it. It's clear. Sometimes you have things with screws of just a millimeter wide. Then where to put the UDI? It's just not possible, and it's bloody difficult to to manage that. There's a working group working now on that, but as far as I know, they haven't come with an answer. So I hope to keep you updated on that.
Right. There's one more that I'm going to squeeze in here, and then we're going to have to close out. We had a lot of other questions. UDI and DI for legacy device emissions and other UDI questions. So we're going to have to reserve that for another event. But the last question for you, Ronald, do medical device accessories need to have UDI-DI and basic UDI-DI? And if they do need to have a basic UDI-DI, can it be the same as the parent device?
Yeah, well, if you have accessories, so an accessory is used to make the device function as intended, then the accessory should be treated as a device. It should have its own basic UDI and its own UDI-DI. The intended purpose of the accessory is different from the what you call parent device, from the device it's supposed to be used together with. So it's a different basic UDI, a different UDI. Just forget it. Don't put different products under one basic UDI unless it's a procedure pack or they are components of a larger thing. But that's a different thing. That's not the question here. Talking about accessories.
Yep. Okay, very good. Thank you, Ronald, for all this good advice. Really good stuff on basic UDI-DI. Sam, do you want to close out? Here's some contact information.
Sure. So here we are. If you want to ask questions again, you can just reach out to meddevice@retech.com. We've got our phone number here, and excuse me, our website. And then you can follow us on Twitter and LinkedIn to find a live and real-time updates. And then here's Ronald Bauman's information for the regulatory consulting. You can reach out to him here for any more questions. And then I think we just had the one more slide, Gary.
No, well, it's a thank you.
Oh, thank you. So thank you all for coming. Please visit our website.
I think we need to.
Excellent resources there. Again, feel free to reach out to me or any of us. We're always happy to help. Thank you so much for joining us.
Yep, great. Thank you, Ronald. Thank you, Sam.
Thank you.